CPR techniques. Performing CPR, cardiopulmonary resuscitation, in flight is a critical skill that cabin crew members must be prepared to utilize in emergency situations. The following steps outline how cabin crew can effectively administer CPR in flight. CPR for adults. Assess the situation. The first step in administering CPR is to assess the situation and ensure the safety of the passenger. Cabin crew must check for responsiveness by gently tapping the passenger and asking if they are okay. If there is no response and the passenger is not breathing normally, immediate CPR may be necessary. Call for assistance. If available, instruct a fellow crew member to notify the flight deck and request any medical professionals on board to assist. It is essential to have additional support during a medical emergency. Position the passenger. Carefully move the passenger to a flat surface, preferably the floor of the aircraft, to provide a stable and secure area for administering CPR. Ensure there is enough space to perform chest compressions effectively. Begin chest compressions. Place the heel of one hand in the center of the passenger's chest, between the nipples. Interlock your fingers and position your shoulders directly above your hands. Administer chest compressions at a rate of 100 to 120 compressions per minute, allowing the chest to fully recoil between compressions. Provide rescue breaths. After 30 chest compressions, tilt the passenger's head back slightly and lift the chin to open the airway. Pinch the passenger's nose closed and provide 2 rescue breaths, watching for chest rise with each breath. Continue CPR cycle. Alternate between 30 chest compressions and 2 rescue breaths, maintaining a steady rhythm and depth to ensure effective circulation and oxygenation. Continue CPR until the passenger shows signs of recovery, medical professionals take over, or you are physically unable to continue. Monitor the passenger. Throughout the CPR process, monitor the passenger's responsiveness, breathing, and pulse if possible. Be prepared to adjust your actions based on the passenger's condition and any changes that may occur. Document the incident. After the situation is stabilized, document the details of the medical emergency, including the actions taken, the passenger's response, and any assistance provided by medical professionals or other crew members. This documentation is essential for reporting and follow-up procedures. CPR for children. Assess the situation. Assess the child's responsiveness and breathing. If the child is unresponsive and not breathing normally, CPR may be necessary. Call for assistance. Notify the flight deck and request any medical professionals on board to assist. Additional support is crucial in managing a medical emergency involving a child. Position the child. Place the child on a flat surface, such as the floor, and ensure there is enough space to perform chest compressions effectively. Chest compressions. Use 2 fingers to compress the child's chest at a rate of 120 compressions per minute, adjusting the depth based on the child's size. Rescue breaths. After 30 chest compressions, cover the child's mouth and nose with your mouth and provide 2 gentle breaths. CPR cycle. Alternate between chest compressions and rescue breaths, maintaining a steady rhythm and depth. Continue CPR until help arrives or the child shows signs of recovery. Key differences between adult and child CPR. Compression depth. When performing CPR on adults, the chest compression depth is approximately 2 inches, while for children, it is about 1/3 to 1 to the depth of the chest. Compression technique. Adults require chest compressions using both hands, while children typically require chest compressions using 2 fingers. Rescue breaths. The method of providing rescue breaths differs slightly between adults and children due to variations in airway size and lung capacity. Rate of compressions. The rate of chest compressions for both adults and children is 100 to 120 compressions per minute, but the force applied may vary based on the age and size of the individual.